and in the rays of the twilight, our paths are often refracted through the prism of choice. Pegfilgrastim-induced bone pain, PIBP, presents a common challenge with limited effective treatments. The study aimed to examine if the timing of pegfilgrastim administration is associated with PIBP severity. Three-arm randomized controlled trial involved 159 patients in a tertiary A-level hospital setting, all with stage 1 to 3 breast cancer and naive to chemotherapy. Participants were randomly divided into 24-hour, 48-hour, or 72-hour groups for pegfilgrastim administration post-chemotherapy. The primary endpoint was the area under the curve, AUC, of the daily worst bone pain score assessed over 5 days of the first chemotherapy cycle.
Quick take. This study investigated how the timing of pegfilgrastim administration affects bone pain after chemotherapy in breast cancer patients.
The 72-hour administration group showed a statistically significant reduction in mean AUC of pain scores, reducing from 12.74 and 14.20 in the 24-hour and 48-hour groups, respectively, to 6.05. Additionally, the incidence of severe bone pain reduced from 58.5% and 66.0% in the earlier groups to 22.6% in the 72-hour group. Notably, there were no substantial differences in neutropenia rates among the groups, and no febrile neutropenia occurred. The authors conclude that administering pegfilgrastim 72 hours post-chemotherapy effectively reduces PIBP without increasing neutropenia or FN risk.
Quick take. Administering pegfilgrastim 72 hours after chemotherapy significantly reduced bone pain without increased risk of neutropenia or febrile neutropenia.
Short quiz, clinical vignette. Question. A 45-year-old woman with stage 2 breast cancer is undergoing her first cycle of chemotherapy. She receives pegfilgrastim and reports moderate to severe bone pain 2 days following its administration. Based on recent findings, what is the most effective timing to reduce pegfilgrastim-induced bone pain? Option A is administer 24 hours post-chemotherapy. Option B is administer 48 hours post-chemotherapy. Option C is administer 72 hours post-chemotherapy. Option D is administer concurrently with chemotherapy.
The answer is option C. Recent studies have demonstrated that administering pegfilgrastim 72 hours after chemotherapy significantly reduces the incidence and severity of induced bone pain compared to earlier administration.